Okay, blood pressure. Some terms I mentioned to you before. Systole. Systole is when the heart contracts. The heart contraction is what we call systole. We also have diastole. This is when the heart relaxes. Okay? So we have pressures for each one of them. We have a systolic pressure and we have a diastolic pressure. We got a pressure when the heart contracts, and see what the blood pressure is like in the blood vessels. And we have it where the heart's relaxed. What's the blood pressure going to be like? So the systolic pressure should be higher than the diastolic pressure, should it not? Okay? So this is where we have this. A blood pressure of like 120 over 80. 120 is telling us what's the blood pressure like when the heart is contracted. It just pushed all that blood into the blood vessels. So now we're taking the pressure in the blood while the contraction is happening. It should be higher. Now the heart's filling with blood, it's relaxed, so now the blood pressure in the blood vessels will go down a little bit, and let's say it's 80. Okay? What is considered a normal blood pressure today? Not 120 over 80. They stopped that about 8 years ago. No, but basically it's 115 over 75. That little difference makes a difference. They've been doing studies and they realize that people with 120 over 80, they get high blood pressure sooner than other people. So this 120 over 80 is what we call pre-hypertensive. Okay? So you're trying to shoot for 115 over 75. That's what you're looking for. Does that make sense? You don't want it too low either, because then you can't push the blood to your kidneys and to all your organs. You don't want it too high because, you might stroke out. The blood pressure will just be so great and you'll rupture have an aneurysm and you rupture your blood vessels. So now it's 115 over 75. It's been like that for about 7 or 8 years. So it's new now. Well, not new, it's been old. All right, so blood pressure, all right? The measure of force exerted by blood against the wall. Now, you've all had your blood pressure taken. Right? You use the stethoscope, that's why I wore this, right? You use a stethoscope and you're going to put the stethoscope over what we call the brachial artery, if we're going to do it in the arm. Some people can't do it in the arms. People have breast cancer and they have their breast removed and whatnot. Then they got to do it something. If it's on this side, then they got to use it over here because they don't have the lymph nodes over here. If they had a bilateral mastectomy, then we have cuffs that go on the legs. So there's other ways. I don't know what they do for a quadriplegic kind of thing, where people lost their arms and legs, but I don't think around the neck. All right. So what they're going to do is they're going to put the stethoscope over here. That's what you'll do. Put the stethoscope over here, over the brachial artery, okay, right in the antecubital fossa. Then you're going to put a cuff over the arm, right, over the bicep and tricep area, and you're going to put air into it to create a tourniquet, to press against the brachial artery to stop blood flow going into your hand. Now, it's not going to, obviously you're not going to do it for very long, just like a minute, and it's not going to compromise your hand at all. But you got to do that. You got to stop the blood, and you got to compare what's happening. You're going to hear certain sounds in here. The sounds that you're going to hear in here are things called Korotkoff Sounds, and you'll hear it getting louder and stuff. The pressure that we're using is the units on here, 120 over 80, it's really 120 millimeters of mercury and over 80 millimeters of mercury. So you should know this, hint, okay? You should know millimeters of mercury, okay? Now, let's talk about the sounds, all right? Everything I'm going to explain is written up here, and you can look it out over here. But what I want to do is show you this one, because this one explains things a little bit better, but there's no words to it. I'm going to verbalize it for you. It'll only take about 10 minutes to do, and then I'm done. So this is what's going to happen. You're going to put the cuff over the arm over here. You're going to put the stethoscope right in the antecubital fossa. So you're going to be listening to the sounds going through the brachial artery. Now let me just explain something too about turbulence. Okay? Let's say this is a blood vessel. Okay? And we usually will have, if nothing's pressing against it, it will have what we call a laminar blood flow. It's just going to go straight through. Perfect, that's what you want. And you won't hear anything. However, if there's some kind of clot here, now the blood, and there's a clot that's against this unbroken vessel, the blood is going to go this way, and when it hits here, it actually moves, it turbinates and goes this way. That is called turbulence. It's not laminar blood flow, it's now turbulent blood flow. When you have turbulence, you hear that blood going around. Okay? That's what you're going to be hearing is turbulence. We could also have turbulence if, let's say, a tumor is pressing on this blood vessel. You're going to get turbulence, and you'll hear that. You could also have a blood vessel that has an aneurysm. An aneurysm is a localized dilation of a blood vessel. It gets very thin there, and it can burst. So if this is your blood flow, or a blood wall, it gets very thin up here, and goes like that. And if you have an aneurysm in your brain, and if you have your blood pressure going higher and higher, this is very thin here. It'll burst. Okay? But when blood goes through an aneurysm, that too is going to create turbulence. And we can hear that too. That's why doctors will be listening to areas in the throat, the carotid arteries, to see if there's any turbulence that they can hear there. They put their stethoscope on either side here. If there's some kind of aneurysm, some kind of clot, they hear something there. If you hear turbulence in a blood vessel, it is a fancy word. It's called a bruit. It's spelled differently though, but it's called a bruit. They listen for bruits in blood vessels. That's not a good thing. If we have turbulence through a heart valve, because there's too much vegetation or too much calcification on there, if we hear turbulence on there, we don't call it a bruit, we call it a murmur. And that's what we're listening to, is turbulence. Because that's telling us there's something going on in that blood vessel. And next thing we want to do is do a Doppler, some kind of ultrasound to that area so we could actually see what's going on with that blood vessel. Okay? Questions on turbulence? Okay, that'll lead to this. We put the blood pressure cuff on the arm here. Stethoscope goes in here. We're going to put air into the cuff, and I usually bring it up, and on the cuff, you'll see the little meter on there. I usually bring it up to about 160 millimeters of mercury. You need it over 120. You know, if one person has, you know, if your average blood pressure is like 115, 120 as systole, you want to get it over that because you want to make sure that you can stop the blood flow, which means you have to get it over that number. Some people's blood pressure maybe 140, 150, high blood pressure. So I usually shoot for about 160 because that's a good number to start off with. When I put it at 160 with a cuff over here, and I don't hear anything with the stethoscope, then I know that I closed it. But if I'm hearing something, because you'll hear the beat up there, then you got to go higher than 160. Then their blood pressure is higher than 160. All right? And a couple times as we did this, we've actually found some people. What's the most common presentation of someone with high blood pressure? No symptoms. People don't even realize they have high blood pressure. They'll be walking around with 200 over 110 and not even know it. Until maybe they have a headache, and that's going to be the sign of maybe an aneurysm that blew. So it's the silent killer is hypertension. Okay? So we actually caught like 1 or 2 people with that. I'm hoping not to find anybody, but you know, you don't realize how high your blood pressure is unless you do it. So I usually do a 160, okay? You go up to 160, and what will happen is the brachial artery will occlude. It'll close up because you put enough pressure on there. So that's what's happening. During systole and during diastole, it's closed. Okay? And then there's a little knob on there, and you're going to unscrew it. There's a little mnemonic to help you remember which way to do it. It's righty-tighty, lefty-loosey kind of thing. So you turn it to the left, it's going to open it up. Now don't do it too much, don't do it too fast, otherwise the air just comes out really fast. Do it slow, and you'll see the meter on the on the cuff go down slowly, because you need to hear certain sounds. So you got to go down really slowly. Not too slow where the person's like, because you have the cuff on them. But you'll see it go down. As it goes down, all right, as the meter goes down, and it's not like this, it's on a round thing. As it goes down, you're going to open up the blood vessel during systole first, because that's when the highest blood pressure is. You'll be listening. You won't hear anything until that blood vessel starts to open. When it starts to open, you're going to hear sounds. Now, it's not going to open round like that. It's going to open where it's going to be squished, which means you're going to hear turbulence. If it's round, you won't hear anything. When you go like this, you'll hear something. Does that make sense? Going back to this, it's being pressed. When you start hearing something, those are called Korotkoff sounds. It'll sound woo, 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 woo. That's what it'll sound like. Okay? As soon as you hear it, note what's on that meter, where that needle was when you first heard the sound. I first heard the sound at 120. Good. Jot that in your head. Don't jot on a piece of paper because you'll miss everything else. Just jot in your head. So you see where that first sound is at 120. Continue letting the air out at that same rate. You'll hear it get a little bit louder, and that's fine, and then you're going to start hearing it softer. What will happen is you'll hear the Korotkoff sounds here, but there's going to be a point where it's going to open during diastole also. You're not going to hear that because you're going to hear turbulence still over here and turbulence here. So it's still, you're hearing Korotkoff sounds during the same because they're both squished, okay? But then it comes to the point where during diastole and systole, they're going to be perfectly round. And when it's perfectly round, you're not going to hear turbulence anymore. So the Korotkoff sounds are going to go boom, 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 boom. And then you note where you don't hear it anymore. And that'll be your diastole number, your 80. Now, here's a common mistake that people do. Both nurses and doctors do this, well, maybe not so much if you have enough experience, but people just coming out of medical school and nursing school. The key is where you note the diastole is where you don't hear it anymore, not when it diminishes in sound. Not whoom, whoom, whoom. You keep on listening. Now you don't hear anything, that's diastole. Otherwise, you're going to be misled, and you're actually calling diastole much higher than what it is. It's when you don't hear it anymore, complete stop. That's what we call diastole. Okay? Does that make sense about this? Okay. All right, so that's all I want to do.